We are here with Plastic Surgery Uncensored, another episode. Very exciting to be back with you, Dr. Raban.
As me, I'm excited to be here.
Thank you. Excitement is always good. And weight loss is exciting. And with the, I'm going to say increased, is there more bariatric surgery now than ever before? Or is it just my imagination?
No, absolutely. There's no doubt that there's definitely more bariatric surgery now than there ever was before.
People are getting, now I remember back in the day, they just had like the pouch, the balloon. Like, first of all, what are the options when somebody wants to lose an enormous amount of weight?
Well, so let's back up one notch and talk about obesity in general. So the reality is, unfortunately, the United States has the largest obesity epidemic in the world. And so there's obesity, there's being overweight, there's obesity, and then there's what's called morbidly obese. And each of them has a different criteria. And unfortunately, I think, and I'm not exactly sure, but I think somewhere near 50% of the country is overweight.
Wow.
30% of the country is obese, and like 25% or 20% are morbidly obese.
1 in 5 people are morbidly obese.
Something to that crazy statistic.
No, I believe you.
As a result, I think what's happened is that from a health standpoint, that obviously has immense ramifications: heart disease, lung disease. You have issues with joints and hip replacements, et cetera. And so there's no question that you need to lose the weight. And ideally, you would lose the weight on your own with diet and exercise. But for many, that's almost impossible. And so with the advent or the increased bariatric surgery, I think we're seeing a tremendous number of people who've lost 100 or more pounds.
Yeah.
And we see a lot of that in our practice. And we kind of call that the massive weight loss phenomenon, or the massive weight loss patient. And so bariatric surgeries, they used to be things like they used to open you up and do a gastric bypass.
Right.
Right. It was called the Roux-en-Y and things like that.
Right.
And those had a whole bunch of issues, things like diarrhea and malabsorption, et cetera. And then with the increased advancements in laparoscopic surgeries, we moved on to doing things laparoscopically. Then subsequently, they started doing things like the lap band, which became very, very popular. There was everybody remembers the 1-800-GET-THIN, those guys who I think now are in jail. But nonetheless, nevertheless.
It's one way to get thin.
Yeah, the lap band phenomenon occurred. And now we've moved, again, I don't do bariatric
Wasn't
surgery.
there a balloon too, that they put a balloon in and blew it up to make it feel full?
I think that's actually occurring right now.
Okay.
And then they've actually moved to the gastric sleeve, where they remove a certain portion of your stomach. Your stomach is smaller, and so on and so forth. So there's always going to be advancements in the bariatric world because there's a huge need for it in the United States. And the bottom line, as far as plastic surgery is concerned, is once that has occurred and you've lost 100 pounds or more, then all of a sudden you're left with all this extra skin, and we need to figure out what to do with it.
I got news for you. I only lost about 35, and my lower butt cheeks look like 2 yards of bad corduroy. So,
That's only 35 pounds. Imagine 100, 150, 200 pounds.
I've seen it. I have a girlfriend who was like Gilbert Grape fat, and she went and did all of this, and she had 4 surgeries. She had to have 4 different surgeries. Now, let's not do a huge deep dive, but I'm curious if people, before they even lose the weight, understand that that's not the whole process, that's the start, right?
Yeah,
that's the start of the journey.
And I think it's really important, like everything else that you're going to do massive in life, you want to plan, right?
You would hope.
You're planning on, you think of having children, you want to have the finances, the backup, et cetera. So when you're thinking of losing 100 pounds or more, yes, absolutely, I think you should do it. But you should also recognize that when it's done, you're only going to be halfway through the journey. Because what happens for a lot of patients is they lose the weight, they feel much better, their health is significantly improved, their cholesterol is down, but now they have all this skin, and they're hiding underneath all this clothes. And for a lot of the patients, they don't feel any better as far as self-esteem is concerned, because, you can't take your clothes off. So what patients need to be prepared for is when you lose a significant amount of weight, there's a high probability, almost 100%, that you're going to have loose skin in your abdomen, loose skin in your thighs, loose skin in your arms, loose skin in your back, and probably loose skin in your neck. And so as a result, you will probably need 1 to, as your friend said, 4 or even 5 surgeries to sort of, if you will, really reconstruct you back to perhaps the way you were before you gained the weight.
Or if you've been heavy your whole life. She was a heavy child. So first of all, the costs. I just want to, you don't do bariatric, but the cost for 4 or 5 surgeries has to be something you plan for. That's got to be prohibitive. For instance, we'll start from the bottom up if you don't mind. She had the thighs look like cottage cheese in bags because she lost over 200 pounds.
Right, yeah.
Like 220 or something. What's that called? Because that was the first one she did was the legs.
Right. Well, everybody does them in different. So I think I think it's really important. First, you hit on a huge topic, which is cost. Cost is always an issue with plastic surgery, but massive weight loss plastic surgery, it's a much bigger cost because you're not just doing one surgery. You're usually doing a series of surgeries, and you definitely need to plan because you don't want to get involved and started in a remodel, so to speak, and then somehow in the middle of it run out of funding.
Yeah, the house is half done.
So, it's better to have at least some of it done than none of it done, but you also want to be prepared for it. So it can be incredibly expensive.
Right.
And obviously, depending on where you go, if you do it in the U.S., if you do it out of the country, if you do it with a board-certified surgeon rather than some non-trained guy, it's going to vary a lot. But the second thing you need to do after you figure out your finances, it could cost upwards of to $100,000 for some people. But the second thing you want to do is you want to plan it as far as timeline. You really want to have a plan. So when patients come to me and they've lost all this weight and they come and say, where do I begin? Like, what do I do? And usually what I do with them is I have them create a wish list. And I say to them, okay, assume you only had money for one surgery. That's it. You can't afford anything else. What would be the thing that bothers you most? And then second, and then third, and fourth, and so on. And what we do is we create a priority list. And then what we do is we work from the priority list rather than necessarily we're working our way up or bottom and so on and so forth. Because the reality is for a lot of people, they'll start it and then they'll run into financial issues or life will happen. And I want them to at least have done the thing that bothers them the most and get it out of the way. And I would say probably 75% of people, it's usually their trunk, their abdomen, their buttock is sagged.
Doesn't it get hard sometimes?
Well, you get a lot of fat accumulation, which then there's skin and irritation and sweating and rashes and fungus. And
she had something called a pannus or something.
Correct. A pannus basically means apron.
Yeah.
And it's the skin that hangs over. And for a lot of people, they get to a plateau and they can't even lose more weight until they get rid of the loose skin because the skin is in the way. Either it's rubbing and creating heat and irritation and infections, or it's just physically an obstruction. Like you can't get on a treadmill when you have a 20-pound apron in front of your legs.
Unbelievable.
So we divide them up, and you were speaking to them. I would say kind of divide them up as follows. There's the body lift or the circumferential belt lipectomy. Basically,
Whoa. You're going to have to say that slow for the layman.
Okay. Circumferential means all the way around.
All the way around.
All the
back
way around.
Included.
The back included.
Wow, okay. Circumferential.
Circumferential belt means it's like a belt. Lipectomy, removing skin and fat. The layman's term for that is body lift. And what it means is it's basically a tummy tuck for the front of your abdomen, but it's like on steroids.
So you can't say fupa remover.
Yeah. Well, you can, but I don't think too many people know what the hell you're talking about.
No, you'd be surprised.
But what's going to happen is you're going to do a tummy tuck for the front, and then you're going to extend it to the thighs and all the way around to the back. And what happens and why they call it a body lift is the stomach comes down, but you're lifting the thighs and you're lifting the buttock. And those two areas, the thigh and buttock, which have significantly descended, are going to get lifted in this procedure. And you're left with an incision or a scar that goes all the way around as opposed to a standard tummy tuck, which is just from hip to hip.
Really?
Yes.
So it goes around their whole body?
Whole body.
And you just like jack up the whole body like you'd push an umbrella up the...
Kind of. That's why we call it a belt lipectomy, because it leaves you like an incision like a belt.
And how do you heal from that if there's no place to lay down? You know what I mean? Like usually if your back hurts, you lay on your front.
I mean,
what do you do for something?
Well, the recovery from the bariatric surgeries, all surgeries, listen, it's interesting because people are under the impression that like, oh my God, I mean, I don't know, is she going to die? I mean, no, human body is incredibly, incredibly amazing. And you're going to recover. It's obviously uncomfortable, probably no more uncomfortable than getting a tummy tuck, no more uncomfortable than having a C-section. These are surgeries. Your body sort of gets a plateau where it's just like, all right, let's just deal with this.
This is the most it can hurt.
Right.
I can't take any more hurt.
It's not really cumulative in that regard.
Okay.
But so that's a body lift. Then there is, of course, the breast. And so more often than not, if you're a female and not a male, you end up getting a breast lift, usually with an implant, because even though you have a ton of breast tissue, it's very deflated. So you get a breast lift and implant. If you're a male, you end up getting what's called gynecomastia. You have all this excess skin around your breast. You got man breast. And you need that gynecomastia corrected. Invariably, there's usually excess skin in the arms. We call that a brachioplasty, and people refer to them as their bat wings or things of that nature.
Right,
And we
lunch lady arms.
Right, we need to remove those. And then, of course, the dreaded thighs. And
the dreaded.
Yeah. And so you get a thigh lift or an inner thigh lift where the incisions are made in the inside. Now, those are the basic 4, so to speak. 1, 2, 3, 4. Then there are the sort of adjunctive things. Depending on your age, you may or may not need skin removed from your neck. The younger you are when you lose the weight, the better you do.
Sure.
But if you're in your 50s or 40s, you might need a neck lift. There's always some stubborn fat, no matter how hot. You may lose 250 pounds, but you have fat stuck in your knees, which is abnormal. You can't even figure it out. You need to remove that through liposuction. And then there are these sort of adjunctive things, like you'll have fat in your back. You'll have fat in on the sides of your breasts, on the sides of your chest and torso. So it is a process of reconstructing that needs to have a plan, a game plan. And you need to both financially, emotionally, and physically plan for it. And if you're in conjunction with a good surgeon, you guys lay it out. It could take 5 years.
I was just going to say, this sounds like a real commitment.
Yeah, well, listen, you don't have to do this, right? You could lose the weight for your health and happiness and just live with the skin. But the truth of the matter is, for most patients, it's really sort of an incomplete journey. And so they have to figure it out. It doesn't have to happen immediately. And you just plan it throughout your life.
I'm fascinated by the skin removal aspect, because she told me, and this could be an exaggeration, it was in the double digits, like 10 or 11 pounds overall of stuff was taken
Correct.
off of her. You can take that much skin off of...
You can. I think the most that I've removed out of the body lift portion was about 13 pounds. Which is a lot. It really is. Most patients, you lose around 5 pounds of skin, because it's just not skin, it's skin and fat. The arms and the thighs may add another couple of pounds. But yeah, I think it's possible. If you've lost about 200 pounds, it's possible to lose 15 pounds of skin during the skin removal.
Wow. And what is the healing like? Again, I asked about the trunk because there's no place to really lay down where you're not laying on a surgery. But just in general, I know a tummy tuck, I've heard, is incredibly painful and takes a long time. I can't even imagine. Let's just suppose you do the around the world. I'm just going to call it the around the world job. Let's suppose you do the around the world job. How long can you expect to be immobilized?
So a couple things. Let me add a little bit of insight. I do think that an abdominoplasty or tummy tuck is painful, but I'd like to make a correction. Yes, I've not had a tummy tuck, so I can't tell you personally, but I've taken care of close to thousands of patients that have. And I will tell you, and you can read testimonials, that the overwhelming majority of people say, this was uncomfortable, but nowhere as uncomfortable as I had anticipated. God damn, I wish I had done this earlier. Because obviously, pain is a major obstruction or reluctancy for a lot of patients. So I want to set the record straight that I think that the pain is manageable. I think people have C-sections all the time. They have hernias fixed, and those are equally painful.
So it's getting a bad rap, the tummy tuck.
Well, it's getting an extra bad rap.
Okay.
Listen, it's painful. No one's going to tell you you're going to walk through, it's Disneyland, but I don't think it's so painful that it's something that you should avoid because of the pain.
Okay.
In regards to the recovery, pretty much most surgeries fall into a relatively straightforward category. You need 1 to 2 weeks off work, so the body lift, as you call it, around the world. 2 weeks off work.
Really? 2 weeks?
That's it. All my patients go back to work at 2 weeks. Now, you work for the U.S. Postal Service, you're not going to go back carrying boxes around at 2 weeks. But if you work an admin or an administrative type thing where you're at a desk, 2 weeks is going to be ample time. 2 weeks, you can go back to work. 2 weeks,
girdles?
You wear a binder on all abdominal surgery for 6 weeks. Not a girdle, but a binder. It's similar to a girdle. And you're going to be out of commission for 6 weeks before you can go back to the gym. And during that 2 to 4 weeks where you're back to work, but you can't go to the gym, you're slowly recovering. And at 6 weeks, you're free.
Your life.
Now, does that mean you're going to go to Barry's boot camp or run a marathon? No. Realistically, for you to get to tip-top triathlete shape, it takes 6 months. But I would tell patients 2 weeks off work, 6 weeks before you can go back to exercise, 6 months before you can kick some ass.
That's great.
It's amazing.
That's not what I thought.
No. It is incredible. And the reality is, it doesn't matter if you do your tummy tuck and breast lift together, your arms and your thighs. It's not cumulative. People are in the impression that if you do 2 rather than 1, all of a sudden it's going to double the recovery. It really doesn't. It really doesn't.
Wow. One last question, because I'm kind of, now you've got me all sucked into this, because I think there's a lot of misconceptions about it. I thought the recovery was much longer. I I agree with you insofar as pain. And I have had multiple surgeries. You and I discussed it. I had a scar revision. I had a burn. I had a skin graft. So you're right. You get to a certain point and it's just like, this sucks. And you just have to, live with it. But my curiosity about this is that, let's suppose the person lost all of this weight. How long does it take for them to psychologically catch up with what their new body looks like? And I know that you can't give a straightforward answer insofar as you're not a psychologist, but this goes much faster than I thought.
It really depends. Listen, most patients don't lose 200 pounds and then like a week later show up in my office and I'm like, I'm ready. First and foremost, the weight loss needs to be stabilized. So you shouldn't be doing plastic surgery after weight loss unless you've at least had your weight stable for a year.
Really? That long?
100%. Because what happens is for some patients, and there's many people who have shown this, you end up having setbacks. It's a lifestyle issue. You gain weight again. And you want to be doing this yo-yoing business. Second thing you don't want to be doing is, for patients, it takes time to psychologically get ready for, the journey that they're about to embark on. So I think it's realistic that a year is something that's within the works. Once you get to the place that you're ready to do this, it's not unrealistic to do these surgeries every 3 months. And I have had patients, now assuming you can afford it,
right?
I've had patients says, I'm ready and I'm going to knock this out. Wow. And so they do the body lift. 3 months later, they do the thigh lift. 3 months later, they do the arm and breast and so on and so forth. And that's going to take me to the next issue. So the question is, many patients say, how many of these can I do together? I want to knock this out. And the truth of the matter is it depends on how it's being done. Unfortunately, many surgeons use a whole bunch of assistants, like a team, to do these surgeries. So when you go see them, they said, okay, we're going to do your body lift and your arms and your thighs at one shot. To me, that
was going to be my next question. To me, that doesn't sound right.
No. So what happens is you just got to ask yourself. So let me tell you my philosophy. I'm really fastidious. I'm super particular, and I have no one help me. When I say no one help me, I mean no one help me. Why? Because you came in and you hired me to do the work, and I can't guarantee any results if my tech, who's just some guy that's in there handing me instruments, or a junior guy that I hired, or my partner comes in there and we're all tag teaming. So normally what happens with bariatric surgery is that they think that their expectations are different than other cosmetic patients. Here you are with all this loose skin, you'll be happy if the skin's gone. So they don't hold themselves to the same cosmetic standards. So you get a bunch of people and everyone's working on a limb simultaneously and you get the job done. And
sounds like changing tires at the Indy 500.
It's kind of like that. So for example, when I do a body lift, it's 8 hours.
Wow.
It's 8 hours for a body lift, which is the biggest of the surgeries, and I do it alone. So that means I do all of the sewing and layers by myself. Now, you could do the body lift in 4.5, 5 hours and have 2 or 3 people do it. So when people say how many surgeries I can do, it's basically how many surgeries can you get fit in a certain day. So if you have a bunch of people doing it, you could perhaps do your body lift and your arms together. Or you can do your breasts, arms, and thighs together. In my surgery, in my clinic, in my office, it's really as much as I can get done safely by myself. So that's a personal decision. You got to figure it out. Obviously, getting it done faster can be more cost effective, but I usually think it's at the expense of compromise of outcomes. If you do something quickly, it tends not to be as good as if you take your time. So that's that.
Wow. I think we've covered
I'm giving you my finger. There's one last thing we got to talk about before we pass.
Okay, because I was going to say, we've got that, but there's a lot of things in the deep dive.
Last issue we need to talk about is we need to talk about the risk. Just in bariatric surgery. Let me just give you a few pointers. Number one, these patients are often very malnutritioned. So bariatric related surgeries, you end up not absorbing a lot of nutrients and things like that. So their healing is not as good as regular patients. So you got to make sure that your nutrition is outstanding. You'll have wound breakdown, things will fall apart, they'll open up and you won't do well. Secondly, they tend to be very aggressive in trying to make things extra tight. So there's a lot of wound complications like things pulling apart. Remember, we're trying to tighten things, and then if you're too aggressive, things fall apart. And lastly is survival of tissue. Remember, this is not magic. So tissue like belly buttons and nipples all require blood supply to survive. So if you go on there and you Google, there's the people who end up getting necrosis or dead or gangrene of tissue, and that leads to a whole lot of issues like infection. So yes, it's awesome and it can be done, but by no means should it be taken lightly. And certainly bariatric patients are at a higher risk than regular patients when it comes to doing plastic surgery.
Well, I want to talk about the risks, but now that we got the overview, I wanted to go back and start with when you said the wish list. Now, a lot of doctors, I think, schedule things insofar as, and I'm going to use the pregnancy. Oh, we're going to do a cesarean section on Thursday because that's the day I do cesarean sections. So going back to the only experience I have, which is my friend, I think there was a specific reason why the doctor said, let's start from here to there, because I don't think that she had the wish list option, or for sure she would have gone trunk first.
Yeah, I mean, most patients go trunk first because it's the big hit. And I call it the grand poobah of your body contouring procedures. And we usually like to get the hardest thing out of the way.
I'm very curious now, when you're talking about it being a journey, I want to know how to plan for a journey, because it's like buying a car in essence. So when we come back, I want to actually start talking price, what people can expect to pay to finish the remodel. If you're saying they're halfway home, what's the rest of the trip going to cost?
Sure, absolutely.
Okay. Ballpark, what does the around the world go for? What does that cost?
So a body lift can cost anywhere from, let's say, depending on some clinics around the country, I'd say from $10,000 to $50,000.
That's a huge price swing.
It is, but you have places that are in middle of nowhere, in a non-certified facility, using a CRNA and being done by a non-board certified cosmetic surgeon.
Okay, I need to have regular CRNA.
Okay, so let's talk about what comes into the cost, so you understand. Why would something cost $10,000?
Right.
And then why would it cost $50,000?
I mean, I understand a car, a BMW versus a...
Okay, well, it's like a car. Okay. And I'll explain you why. So what I want you to understand is, before you can figure out why something costs something, I don't care if it's your house, whether it's a car or your surgery, you need to understand what the components are, so then you can understand why each component is more or less expensive. This isn't I'm going into Hermes and it's a label and it's just a label and it's just because. No, there's a reason. So what are the entities? First and foremost, of course, the most expensive component of your surgery is your surgeon. So you have, on the one end, you have a board certified plastic surgeon who is incredibly experienced with the particular procedure that you're having done, with an immense gallery of before and after works that are appealing to you.
Beautiful.
And an impeccable record of reviews that state that this person is a decent human being. That would be your gold standard. On the counter side is an individual who's not board certified, is not a plastic surgeon, is a cosmetic surgeon. We've discussed this in other podcasts.
And we'll continue to, because it's
And I'm going to keep
important.
repeating it, which means they're not plastic surgeons, means that they're ENTs, dermatologists, ER doctors, orthopedists, general surgeons, whatever you like, calling themselves cosmetic surgeons. So they're not plastic surgeons.
And they're always creeping out of their little specialty, aren't they? Yeah. Always creeping.
So not board certified, not plastic surgeon. Barely does this because this is a subspecialty of its own. Doesn't have a whole lot of photos online. The reviews are touch and go. And in general, you don't get a really warm and fuzzy feeling about them. So that's number one and probably the largest component of the cost. Other things, where is the surgery being done? So you have facility fees. It has to be you have to operate in a facility.
Sure.
So you have expensive facilities that are state-of-the-art, Medicare certified, meaning that Medicare came in there and made sure that the doorknob was at the right height and then everything is perfect, all the way down to less particular certification entities that are not as vetted. Not as vetted. And so you have state-of-the-art facilities that are standalone, and you have little rooms in doctors' offices that are sort of their own ORs. So you have different costs in facilities. You have different anesthesia providers. So you're having anesthesia for 8 hours. I don't operate on any patient without my team of anesthesiologists. These are not random people. These are not people I just bring in off the street. These are the crew of people that I've worked with for 15 years. They put my mom to sleep. They put my niece to sleep. And they're also board certified, as opposed to what? You could have a CRNA, a nurse anesthetist. Nothing wrong, nothing illegal. Some of my closest friends are nurse anesthetists, but you have to know what you're paying for. They are less expensive, right? So you're paying for the OR, you're paying for the facility, then you're paying for follow-ups. They don't charge you for follow-ups, but like, for example, I see my patients 5 to 7 times in a year. That's like
your time.
Twice as long as most people. I take 8 hours to do the surgery instead of 4 hours to do it. So that 8 hours means more OR time, more anesthesia time, more facility payments. So you can't just say, oh, this guy's 50, this guy's 10. Why the hell would I spend 5 times more? You need to know what it is that you're getting. This is the analogy I use, and I'll use it over and over again. You can buy an Hermes bag or you can buy a Coach bag. Both bags carry crap. They both do the job. The question then becomes, is the extra leather, the stitch, the handwork, the warranty.
You read my mind.
Is that stuff important to you or is it not?
Well, the difference is you put a bag down. Your body's your body.
Right. But my point being is that you just need to ask yourself personally, once you know what you're saving on, then you need to ask yourself, for example, if you don't care that a car has a sunroof and you're saving $500, good. You know what you're paying for and you're saying it's not worth it to me. The problem is patients when they say, oh, I'll spend 10 grand, they don't know what they're not getting. And they're not finding out what they're missing out on. When you tell them, oh, by the way, your sewing is going to be done hastily. I don't want that. There's an assistant in the room. The tech is closing.
You're getting a knockoff trunk job.
Right. Well, at any rate, I did think so. That's really important. So that when I say 10 to 50, so that's why. So body lift is 10 to 50. I think that the breast lift and implant can be anywhere from probably $7,500 to 25 grand. The thigh and arm lifts can probably be the same, 7,500 to probably 25 grand. A facelift can be anywhere from 10 to 30 grand. And, all the little adjunct things in here and there. So yes, the pricing can vary greatly, but I am such a firm believer because I do so much revisional work. At the end of the day, if things don't work out, you will pay more and you will suffer more and you may never get the result that you would have initially. It's way better to pace yourself, spread this out, do one at a time, knock them out, have amazing results, than to do them all together quickly and try to get it over with and then have sort of a piecemeal work. But that's a personal decision.
I have to circle back to the wish list because that struck me. I love that so much. And now that we're having this conversation, after the Hooter hike, I think I'm going to go for the
There you have it.
Yeah. I think I'm going to take care of the bad corduroy on the back of the butt.
There you go. So I think in general, bariatrics are...
It gives you hope.
Yes. You feel empowered.
You feel excited. I get to pick what gets pretty first.
Yeah. So I think I think this whole subject is so important and it's becoming such a
there's so much identity tied into it. Like that's your whole body. It's your billboard of who you are when you walk in a room.
Yeah.
And I think
the biggest issue is for many, many patients, they live a double life because once you've lost all that weight, to the outside world, you seem like you feel great, but inside you and only you and your intimate partners know what's really going on. And I think it's really amazing that we can make such a massive impact in these patients. So I'm a huge believer.
I don't want to get ahead of us for the next show because I'm so excited, but we are going to talk about the whole intimacy issues surrounding these things. And just so you know, when people say like, when can I go back to work? When can I go back to the gym? One of the questions on their mind is probably like, when can I show it off? When can I take it on a...
Oh, I hear that people ask all the time. You didn't spend all this money, so you don't use it. You want to use it. So, we usually tell them intimacy, sex, things of that nature fall right in the category of exercise.
Okay, good to know.
All right.
Thank you so much, Dr. Raban, for really breaking it down for us. I've enjoyed this episode of Plastic Surgery Uncensored, where we have totally handled the beginnings. There's going to be many more conversations of what happens when you go from, Walmart greeter to a hot chick, or for dudes, hot dude, stud. We go from chunky to hunky. Yeah, well, I'll think of the good names. So it's been a pleasure.